They're doing good. And hello, everyone. Welcome to the first in the series, the webinar series leading up to the gathering in Puerto Rico for the Ancestral Institute 2024 edition. Today, we are going to look at and focus on one aspect of building the institute, which is culture and religion in understanding mental illness. Presenting this webinar for us today is Odwa, and I will ask him to introduce himself and pronounce his name so that I don't screw it up and make a mockery of his name. We, with our Western understanding of languages and people's names and cultures, so I will ask Odwa to introduce himself. But I want us also to think about how does culture and religion, and how do we understand culture and religion and in mental illness. This, as I said, this webinar is part of a series that is hosted and presented by students under the tutelage of Professor Yassin Ali at Mandela University in South Africa. These are graduate students in psychology, and they're all leading up the webinar series leading up to the cultural gathering for holistic health and wellness, uniting indigenous and diasporic practices in collaboration with the University of Puerto Rico in Puerto Rico on November 8th to the 10th. So before we begin, we'd like to ask you all to let's make this space online a safe space. A space where we can feel comfortable, where we can feel accepted, where we can feel belonged. Because for many of us, throughout many of our histories, we don't feel comfortable in many spaces. But while we are online, we have to remember a few basic etiquette rules, such as, please mute your microphone. If you want to ask a question, please put it in the chat. And at the end of Odwa's presentation, I will raise the questions with him. If you want to have your microphone on, if you want to have your camera on, you're welcome to do so. But understand that it may also impact the signal strength and the bandwidth. And if you're going to have your camera on, then please don't be eating in front of us. Please don't be digging out your nose or scratching your nose. Or please don't be doing anything like shuffling papers or talking to other people, because it becomes distracting for the presenter. So just to remember those basic etiquette practices for online. So before we actually get into this, I would like us to take a moment in silence, just to spend a moment in silence as we bring to mind who we are, where we come from, and why we are here. Let's ask ourselves these three questions. Who am I? Where do I come from? And why am I here? Thank you. Our presenter today is Odwa. He's a lecturer and researcher currently pursuing a PhD in psychology at Nelson Mandela University. His academic journey focuses on the intricate dynamics that arise from the intersection of Western and African frameworks in the field of psychology. With a keen interest in understanding human behavior, Odwa's research explores the complexities of both individual and group levels, delving into the sociocultural and psychological processes that shape individual behavioral variations. His work aims to bridge cultural perspectives, contributing to the development of inclusive and culturally sensitive psychological theories and interventions. About today's presentation, Culture and Religion in Understanding Mental Illness, our presenter, Odwa, will present that this presentation is centered around research that has been successfully conducted and a paper published exploring the intricate dynamics between culture, religion, and the understanding of mental illness among residents of the Eastern Cape province in South Africa. This research endeavors aimed to achieve several pivotal objectives. The research comes and outcomes offer valuable implications for mental health interventions and policies, emphasizing the importance of a culturally informed approach in fostering improved mental well-being, not only in South Africa, but to the rest of the world. Community members, it is my honor to present Odwa, and I will really and truly allow him to introduce himself as he will pronounce his name. Odwa, over to you.
Thank you so much for that warm introduction, Mr. Craigwell. Greetings, everyone, and thank you so much for joining us today on our first webinar that is on culture and religion in understanding mental illness. My name is Odwa, and my surname is Sekweke, and I am currently a lecturer and a researcher, and I'm also pursuing a PhD in psychology at Nelson Mandela University in South Africa. So I am excited to delve into this fascinating as well as this important subject with all of you today. And I hope that it will set the tone for the upcoming webinars as well. And I know for a fact that my colleagues will give you insights into this field of research. So this topic is particularly close to my heart because my research has over the years concentrated on exploring the indigenous knowledge as well as perceptions of mental illness in diverse backgrounds. Okay, so in my academic journey, I've also been engaged in understanding how different cultural and religious frameworks influence our interpretations as well as our responses to the mental health issues that we face every day. So I have focused also on how traditional beliefs as well as practices intersect with each other and also how they intersect with the Western psychological theories and also approaches. So I am very passionate about the subject because I believe that it bridges the gap between indigenous knowledge as well as modern psychological practice. So I believe that now by integrating in the indigenous knowledge as well as cultural insights into our mental health framework, we are able to develop a more holistic as well as a more inclusive approach to dealing with mental illnesses. So I will be sharing with you my slides for today. Can I just quickly confirm if you can see them?
Yes, we can see them.
All right. Thank you. All right. Today, we will be discussing how culture and religion intersect with our understanding of mental illness. That is now specifically in the South African context, with the hope that this knowledge we are able to apply to different communities across the world. So we will be exploring at how different cultural and religious perspectives shape our perceptions, how they shape the diagnosis of mental illnesses, as well as how different groups of people seek treatment for mental health conditions. So I hope by the end of this session that you will have a deeper understanding of how these factors, that is now culture and religion, influence mental health, as well as practical strategies that are used in mental health care. So understanding how culture and religion influences mental illness is important for different reasons. And first and foremost, it also allows us to recognize as well as to appreciate the diversity in how mental health issues are perceived and also how mental issues are managed across different cultural and religious contexts. So different cultures and religions, they often have, they often adopt those different as well as unique frameworks in order to understand mental illness. And these can significantly impact both the experience of the mental illness as well as the approach for treatment. Okay. If I make an example, in some cultures, they view mental illnesses that is now through the spiritual lens, and they are attributed to spiritual or even moral causes, while others they might focus on biological as well as psychological factors. So I believe now that knowing this is important because it will enable us as mental health practitioners to provide mental health care that is both effective and also mental health care that is respectful of the individual values and beliefs. And also, I believe that now also addressing these cultural and religious and these religious factors in mental health care will play an important role in also reducing the stigmas that surround mental illnesses in different communities and also improving access to services. Okay. Now that I have introduced the topic, I want us now to look at mental illness. Just a brief overview of what mental illness is in case some of our audience are people who do not have a background in psychology. So a mental illness is actually a broad term. It is a broad term that include different conditions that affect our moods, our thoughts, and also our behavior. And these conditions can disrupt a person's ability to function daily. It also has an impact on their overall quality of life. And these types of illness are actually different. So these include, for example, mood disorders. It includes anxiety disorders. It includes psychotic disorders. It also includes obsessive compulsive disorders and also many personality disorders. And each one of these has its own symptoms as well as its own challenges. For example, we know that depression and bipolar disorders, they fall under mood disorders, and these are often characterized by significant changes in moods as well as changes in emotional states. So mental illness in general is not an uncommon word. And in fact, it actually affects millions of people throughout the world. And also the World Health Organization has reported that depression, for example, is the leading cause of disability globally. So these statistics, they actually underscore the widespread nature of mental health issues and also their profound impact on people as well as on our societies. So cultural and religious factors, they also play a significant role in shaping our understanding of mental illnesses. For example, in some cultures, mental health conditions might be interpreted as spiritual or as moral issues rather than other cultures who ascribe it to medical reasons. So similarly, religious beliefs, they also can influence how individuals seek their treatment. That is, either they prefer the Western modes of treatment, or they might seek the faith-based approaches. So understanding these cultural and religious influences is important. That is now in order to provide effective mental health care. So now as we move forward, I want us to explore how these factors affect the perception as well as how they affect the treatment of mental illnesses in different contexts. Now, I want us to look at this in the South African context, for an example. In South Africa, it is a remarkable diverse country, which is also known for its a rich tapestry of cultures. It has different ethnicities, it has different religion. Now, this diversity is so profound that it has earned our country the name a rainbow nation, which means that now it reflects the vibrant as well as the multifaceted nature of its population. Now, South Africa is a home to many different ethnic groups, and each group has its own unique cultural heritage as well as its unique traditions. And amongst these groups, we have the Xhosas, we have the Pedi, we have the Zulu, we have Ndebele, we have the Khoisan, we have the Tswana, and each one of these ethnic groups contributes to the nation's rich cultural fabric. Now, in addition to South Africa's ethnic groups, we also have many different religious communities. We have our Christians, we have Hindus, we have Muslims, we also have Afrikaners, and all these, they contribute to the rich fabric of South Africa. Now, the interplay between these diverse cultures and religion has a significant impact on how mental illnesses are perceived and also how mental illnesses are managed throughout the country. Now, in South Africa, cultural beliefs, they actually play a very important role in shaping the understanding as well as the treatment of mental health issues. For instance, in the Amaxhosa tribe or in the Amaxhosa people, mental illness are often interpreted through a spiritual or through an ancestral lens, whereby now we have a ritual which is known as ukuthwasa, which is one that is often observed among the Amaxhosa. Now, ukuthwasa is, as I've said, is one of the conditions that is often observed among the Amaxhosa, and it is often characterized by symptoms such as hallucinations or intense emotional experiences or altered states of consciousness. Now, all these symptoms are traditionally viewed as manifestations of spiritual or ancestral disturbances rather than medical issues. Now, as a result of these cultural interpretations, individuals from the Amaxhosa tribe, they often experience these symptoms and they often seek assistance from traditional healers rather than visiting a conventional psychologist or psychiatrist. So our traditional healers, who are known as Sangomas or Izangoma, they actually play a very important role in our communities by addressing some of these issues. And these can be addressed through spiritual rituals, through the use of herbs, or through consultations with our ancestors. So this preference for traditional healing underscores the deep connection between the cultural beliefs as well as mental health care. That is now highlighting the importance of us integrating cultural understanding into our mental health practices. Therefore, for example, in a country as culturally rich, as diverse as South Africa, it is important to acknowledge and also to respect these different perspectives, that is now these different cultural perspectives, as it will be important in order to provide effective as well as compassionate mental health care. So it allows for a more holistic approach that honors the cultural and spiritual dimensions of mental health which might lead to better outcomes as well as a more inclusive healthcare system. Now, moving on, South Africa's mental health system is predominantly shaped by Western biomedical models, which focuses on diagnosing and also treating mental illnesses through a clinical lens. Now, while these models have been effective in many different settings, they may not fully address some of the diverse cultural needs that are present in South Africa, because now this monocultural approach, it often fails to consider, the different cultural beliefs as well as the different practices that influence the perceptions as well as treatments in these different communities. For example, the Western models, they emphasize a medical understanding of mental illness that is now focusing on symptoms and treatments within a framework, and that framework in most cases does not align with the traditional beliefs. So in contrast, many South African communities, they view mental illness through a cultural or through a spiritual lens. That is now attributing whatever symptoms or whatever mental illness they're going through, attributing it to a supernatural force or to an ancestral spirit. And as a result, this is where now traditional methods come into effect. And these are often preferred. And now this reflects now a cultural understanding of mental health that now might be overlooked by these Western approaches. So it is important now that we integrate now culture and also religious perspectives into the mental health care in order to provide a more comprehensive and also a more effective treatment to these communities. So by understanding how these different cultures and religions interpret as well as manage their illnesses, the mental health professionals now are able to develop practices that are more respectful and also practices that are relevant to the communities that these practitioners serve. Now, culture and religious beliefs have a profound impact on mental health care in South Africa. And these beliefs, they often shape how different individuals understand mental illness, and it also influences the choice of treatment that they seek. So for many communities, mental health issues, as I've said, they're often attributed to spiritual or to ancestral causes rather than attributing them to medical explanation. So these cultural and religious frameworks are deeply interwoven into the understanding of mental health. Now, these mental illnesses are often seen through a perspective of spiritual or ancestral influence. So they are believed to be caused by spirits as well as to have ancestral influence. And this is when now traditional healers or traditional healing plays a significant role in many South African communities. That is now through the use of spiritual rituals, the use of herbal remedies, as well as consultation with ancestors in order to address these mental issues. So now these healers, they are often preferred within their communities. They play an important role to the cultural framework of mental health care, meaning that now their practices are often rooted in long-standing traditions, and they're often sought out by individuals who view these methods as more culturally aligned with their beliefs compared to Western medicine. So in South Africa, traditional healing is not just merely an alternative, but in many communities, it is a preferred approach because it aligns with the cultural values as well as the spiritual understandings of people. Now, this preferred this preferred way of treatment, that is traditional healing over medical treatments, it highlights a critical aspect of mental health care in South Africa. So conventional Western approaches, they focus on clinical diagnosis as well as treatments, and then they do not always resonate with the cultural and the spiritual beliefs of these diverse communities. Now, as a result, many individuals, they often resort to traditional practices that they believe to be more accurate and more accurately addresses the root causes of their mental issues, and it also offers solutions that are more in harmony with their cultural as well as spiritual perspectives. So it is important that we understand as well as integrate these cultural and spiritual dimensions into mental health care in order for us to provide effective as well as respective treatment. So by recognizing the importance of traditional practices and beliefs, now we as professionals can work towards a more inclusive as well as a more culturally sensitive approach, thereby bridging the gap between conventional as well as the traditional methods into treating mental illnesses. However, there are significant opportunities to bridge the gaps in mental health care, and that is by integrating the cultural as well as the religious perspectives into treatment approaches. So, and that can be achieved now by developing cultural competence. This is when now mental health practitioners can enhance their ability to understand as well as to respect the diverse views as well as the practices that are related to mental health that exist across different communities. So cultural competence involves not only gaining knowledge about the different beliefs, but also adapting the attitudes as well as the practices that are sensitive to and also that are inclusive of these diverse perspectives. And one effective way to integrate these perspectives is through collaboration with traditional healers. Now, these traditional healers are deeply embedded in our communities, and they play a very important role in mental health care. It is now these traditional healers, they possess valuable insights into the cultural as well as the spiritual understandings of mental health issues. So by incorporating their knowledge as well as their practices into our treatment plans, we as mental health professionals can create a more comprehensive approach, one that respects and also one that utilizes the strengths of both traditional as well as Western medicine. So this collaboration can lead to a more effective as well to a culturally attuned interventions, also improving patient engagement as well as the treatment outcomes. Community education can also play an important role in bridging the gap between traditional as well as conventional mental health practices. That is, now we can do this now by educating our communities about mental health in a way that acknowledges and also in a way that respects their cultural and spiritual beliefs. And this will foster better understanding and also the acceptance of different treatment options. Now, there are some of these practical strategies that can be implemented, and I think we've already touched on developing cultural competence amongst our mental health practitioners, as well as to collaborate with the traditional healers, and also to foster a supportive environment. That is now to create an environment whereby it is inclusive of different groups of people. And this now would include developing policies that accommodate cultural and spiritual needs, such as a flexible appointment scheduling that respect, for example, religious observations or observances, as well as cultural events. And also one strategy that can be implemented would be to evaluate as well as to adjust practices regularly, meaning that now this way we can incorporate input from the patients as well as the communities to ensure that our mental health services, they remain effective and also they remain culturally relevant. So this can often involve conducting surveys, hosting focus group discussions, as well as community consultations as a way to gather feedback on the effectiveness of these integrated practices. Now, integrating these cultural and religious perspectives into our mental health care system might come, or it does come, with several challenges. And understanding these challenges is very important in order to develop effective solutions as well as to improve mental health care services. One of the challenges, which is a significant challenge, is a potential for misunderstanding or misinterpreting cultural beliefs and practices. Now, in this case, mental health professionals do not fully grasp the cultural context of a patient's symptoms. And then in cases such as these, it may lead to inappropriate as well as an ineffective treatment approaches. So this lack of understanding can also erode some trust between the patients as well as the practitioners, which makes it harder for patients to engage with and also to benefit from the mental health care, especially if they're being misunderstood, as well as if there is bias. And also one challenge that is also evident when integrating these cultural perspectives in mental health care is the resistance to conventional medicine. And in this case, many individuals, they prefer traditional or spiritual healing practices over the conventional medical treatments. And now this resistance can affect their willingness to seek to or to also adhere to the conventional mental health care. So which often leads to a suboptimal treatment outcomes. So addressing this resistance often involves recognizing as well as respecting the patient's preferences, but also finding ways to integrate traditional practices into the treatment plans where appropriate. And another challenge is the fragmented health systems, whereby now it includes health systems that lack the integration between traditional as well as conventional mental health care, which, as I said, it results in a fragmented treatment approaches. In South Africa, this fragmented nature of healthcare system, it does create barriers to a coordinated care. So this fragmentation can lead to disjointed treatment options that is now reducing the overall effectiveness of mental health services. So it's important that now we enhance this collaboration between traditional healers as well as practitioners, that is now the Western practitioners, in order to provide comprehensive as well as cohesive care. Another challenge that comes when integrating culture and religion into mental health care are the communication barriers. That is now the language differences. They also pose a significant challenge in mental health care. For an example, in isiXhosa, that is now the isiXhosa language, there are often no specific terms for different mental illnesses. For example, in isiXhosa, there is no term for schizophrenia. So it often becomes an issue now when in practice. So this lack of terminology, it often makes it difficult now for mental health professionals to accurately assess or to also diagnose as well as to treat these mental issues. So it's also imperative in developing strategies to bridge these language gaps, that is now such as maybe using interpreters or also using culturally relevant diagnostic tools, which might be important for effective communication and care. So addressing this challenge will require a thoughtful approach that is now one that includes enhancing cultural understanding as well as respecting the individual preferences and also fostering collaboration between the different care systems. That is now the collaboration between traditional healers as well as Western professionals, and also improving the communication strategies. So by tackling all these issues, we can work together towards a more inclusive and also a more effective mental health care in South Africa. Okay, I don't want to go into much detail, and hopefully the following webinars will share some very insightful arguments and some very insightful research with regards to this field. So I want us now to transition to our Q&A session, and then we can have a further discussion with regards to the presentation. So Mr. Craigwell, I will hand it over back to you.
Thank you very much, Odua. So if there are any questions, please unmute yourself, and you may ask your question to Odua. Any questions? So we've got one question in the chat. You could unmute yourself, Selena, and ask your question.
Okay, thank you. And thank you so much for your presentation. I hope you can hear me well.
Yes, we can.
Okay, good. My question, I'm very curious to know how the experience has been with including or integrating traditional healers and sangomas into the conventional care. And you did touch on that, and wondering, from your perspective, what do you believe needs to be in place to get full buy-in from traditional healers, sangomas, to participate in conventional care?
Thank you very much for that question. Well, it is a still ongoing approach. It's even though there are attempts to integrate traditional healers into mainstream psychology, it still becomes an issue. And that's one that is still ongoing. And I believe that now through research and as well as through the development of policies, it will make it possible. Well, it's not something that's yet put in place or something that's working already, but it's still an ongoing project. And I believe that is through now our respective research and also through development of policies, it can also make it something that's more possible.
Thank you.
Are there any other questions? I see that there are a number of people from South Africa who joined the webinar. Any questions from you about integrating culture and religion with mental health care? Odua, one of the things that I was listening to as you were talking and came up in my mind is you are studying in Nelson Mandela University with a graduate program for psychology. What kind of psychology are you studying that you are able to bridge contemporary Western psychology with traditional beliefs as you've described? How are you able to bridge the two or to connect the two to make it relevant for yourself as well as for community members? And when you're finished answering that question, I see Professor Wandile Sabedze has raised his hand as well.
Thank you. My focus on psychology is more on research rather than practice. And I believe that now through research, we are able now to bridge the gap between indigenous knowledge system as well as conventional psychology. There's now through research, for example, in my master's degree, I was looking at the perceptions, at the attitudes, as well as the treatment options of people in a community in South Africa. And most of these people, they would resonate with the indigenous ways of healing. So through my research now, I could prove or I could argue that indigenous knowledge system or the indigenous ways of treatment are more effective in different cases or in different contexts in South Africa.
Thank you, Odwa. Wandile?
Thank you, Antonia, and thank you, colleagues. Odwa, for me, it's not actually a question, but I would just like maybe for you to reflect back. This was a great presentation and very relevant. And I would say I was still listening, and I thought there was still more that has to come. But I think when we engage and have a conversation with you, you're gonna give us more. And I think if that's your approach, it's working. So Odwa, I'm just thinking, I have a PhD student who is doing almost the same what you are presenting now, looking at the healthcare workers and traditional healers coming together to work and through therapy and healing for people in the South African context. So I just want to ask you to say, based from what you have been doing in this space, what are the African principles or ethics that we as researchers we forget about when we do such work, more especially when we get into the space of traditional healers? What are the African principles or ethics or traditions that we forget? We even forget to put them down when we write maybe such papers or proposals. So I just want to find out, or even presentations, to say the ethics are different. The Western ethics and the African ethics are actually totally different on how we enter the space. So I just want to, more especially in the traditional healer space. So I just want to find out to say what is your experience when it comes to the traditional healer space? Thank you.
All right. Thank you very much for that question. It is also quite interesting question, and I think that's one that also needs to we need to have more conversations around that that question or that topic, especially now when interacting with traditional healers. You know, in most cases, when people are conducting studies, or from what I've had or experienced, people, they always approach traditional healers with an attempt to question their practices and or to discredit their way of doing things, especially people who are more inclined into the Western approaches to treatment. So they always approach that in that way, of which I wouldn't classify it as a good way to do that, because also when it comes to this alternative approaches in our traditional healing, it does not discredit the Western approaches, but it actually offers an alternative treatment plan. That is now for those people who find the Western approach to be ineffective. So that means now they have an option now to adopting this option, this treatment option that actually aligns with their values. That is now what actually aligns with their beliefs. So that means now if someone believes that now this is the cause of their issue, that means now they need someone who's gonna look into it from that perspective, rather than someone who's gonna come and diagnose from a different perspective. I'm not sure if I answered your question.
Thank you, Odwa.
Next, we have Professor Letsualo, and after Professor Letsualo is Dr. Ojeade. And then after Dr. Ojeade, I see that Dr. Mandu has put a question in the chat. And so, so that I don't misrepresent or miscommunicate Dr. Mandu's question, I would invite Dr. Mandu to unmute themselves and ask the question. Zama, you would ask your question after Dr. Mandu. So the order is Professor Letsualo, Dr. Ojeade, and then Dr. Mandu, and then Zama. Professor Letsualo.
Thank you, Antoine. Thank you to the presenter. I just want to know, and of course I do acknowledge the limitation of the fact that the presenter it's a researcher rather than a clinician, of course, because the perspective will be different if you practiced sometimes. So what I would like to know is that he has been interrogating all this literature, and I can see that he went deep into it. So I'd like to know now, since we have all this information and we have this resistance, I mean, the issue of integration has been going on for years in South Africa, but there seemed to be some sort of a seesaw movement. We are going back and forth, but there seemed to be no much that actually is done on this aspect. So I'd like to know from the presenter himself, to say him personally, what do you think is the way forward here? Because we keep getting this some sort of a rubber band when it comes to us moving forward. When we take one step forward, we take two steps back. So I just want to get his views. And of course, as I said, I do acknowledge the fact that you are a researcher, and I do acknowledge the limitation that perhaps the practical experience, we will shelf it. So I just want to get your thoughts on this. Thank you, Andre.
Thank you so much for that question. And I think you've raised actually one of the most important question. That's one that also we have been asking ourselves. That this has been going for quite some time. It's been something that has been attempted in the past, and is still an ongoing approach to try and integrate indigenous knowledge or ways of treatment into mainstream practice, of which, yes, it is an ongoing conversations. And I believe as a researcher from my side that through our research, and also through our ongoing conversations and through collaboration, we can come to to develop policies around that integration. Because yes, with the HPCSA, there are limitations now, especially when it comes to such, and now venturing into indigenous knowledge aspect, it does somehow violate some of the policies of the HPCSA. So I'm also looking forward to also hear some ideas, also what other people think we can do in order to be able to effectively integrate.
Thank you, Adwa. Dr. Ojeade. Are you still there?
I am. Greetings,
Yes.
everyone. Thank you for having me. Actually, now I'm changing my question just based on what I just heard from Adwa. The HPCSA, I don't know what that is. So, one, I wonder if you could tell me a little bit about what that is and what about the traditional healing would violate those policies. But then my original question is really around just the thoughts that I've been having. So you can probably tell by my accent that I live in the United States. I am a licensed psychologist, but I also do a lot of work, writing and then clinical work around integrating African traditional healing practices into therapy. And one of the things that I have found with my writing is that I get frustrated in my Western training always coming first in terms of presenting mental health concepts. So I'm always starting with this foundation, which I see as a colonial and a white supremacist foundation of writing from the Western perspective and then attempting to explain concepts based on this Western foundation. So Adwa, I'm just curious for you, just in terms of the material you presented today, or as you're writing and researching, do you ever find yourself also frustrated with that kind of need to explain things first from a Western perspective and then kind of secondarily explaining concepts from a more traditional indigenous healing perspective? So thank you.
Thank you for that question. First and foremost, I wanted just to answer your first question with regards to what the HPCSA is. Now, it is in full, it stands for the Health Professions Council of South Africa, which is a body that is established to regulate, the health professions in South Africa. So it has some sort of framework on how professionals are required to practice. So that is what the HPCSA say. So there is a way that practicing psychologists are supposed to conduct themselves in their clinical settings, and oftentimes it comes as a limitation, especially when dealing with issues such as ancestors, such as culture and religion. So it kind of limits professionals in that sense.
Thank you very much, Adwa. Dr. Mandu, do you still want to ask your question?
I think he has already responded to it when he was trying to outline the challenges that we have with regard to the HPCSA. And he was even asking the audience if ever they have maybe ways which they can address an issue that I have put on the table, that I am a clinical psychologist and I'm practicing, and I'm also a chakra reader. So sometimes I feel that I have a challenge of an ethical dilemma where I'm treating clients with spiritual issues, but because I'm a very strong believer in terms of integrating the biopsychosocial spiritual aspect in my treatment of the clients. So I often find myself having a challenge, because it's like the Western method or way of treating individuals is only limited to biopsychosocial, and then the spiritual aspect is not integrated. And it becomes a challenge, because when you try to bring it in the session, it's like you are always watching as to whether the big brother, whom we regard as the HPCSA, is watching at you, that, oh, you are violating the policies, and you might be struck out of the system because you are not doing what is being prescribed. And the second thing, apart from chakra reading, I sometimes I have joined the hiking. I have realized that, you know, in the hiking, there are so much benefits, especially in grounding an individual, because, you know, as Africans, we connect very beautifully with nature. So I'm tempted to bring the therapeutic aspect in that atmosphere or in that space. But the challenge is we are taught to be in the office, to sit with the client, to have a chair, being in a particular way, not to be in the forest. And it's a challenge. I don't know, perhaps there are other therapists out there, especially in South Africa, who knows or who are guided by the HPCSA policies. How then can we navigate our way towards winning this battle? Because we have been having presentations, such as this ones, the workshops such as this ones, but I feel like we seem not to be having a way forward, and we are also requesting perhaps the people in academia to push it very hard so that we do not only present and publish, but we as clinicians, we can practice what we feel is relevant for the people of African ancestry.
Thank you very much, Dr. Mandu. Odwa, do you have any comment or response to Dr. Mandu's commentary?
I think she has actually raised a very important aspect, that is now the ethical and the professional boundaries that are set by the HPCSA, meaning that now when you integrate these traditional or these spiritual practices now into practice, they actually raise ethical concerns. So that way they do limit this aspect. So yeah, that.
Thank you, Odwa. Dr. Mandu, perhaps after this webinar, we can connect and discuss some more about the Ancestral Institute in Puerto Rico, because you may have an insight here that might be valuable to contributing to the building the Ancestral Institute. And as both you and Odwa are alluding, is that looking at ancestral healing rites and practices to address mental illness and mental health in traditional or ancestral communities may come up against Western European and American ethics and policies and procedures. And so we may need to look and ask the question, how do we address those, or how do we interact? How do we deal with those issues when they come up? Or do we then craft our own ethics and policies that show how our communities can be healed using ancestral and traditional means? So I'd like to talk with you a little bit more about this after this webinar. So if you registered, then I may have your contact information and I can send you an email to follow up. The next person that I'd like to invite is Zama. You raised and asked a question in the chat. Would you unmute yourself and ask the question again, please?
Evening, everyone. Thank you, Odwa, for the presentation. So Dr. Mandu kind of gave me some thinking on what I was trying to ask about how receptive are clients and communities to this integration, because what I've seen is that a lot of the time they either push back. So they would either depending on their issue, it would be they would go into the traditional or ancestral or religious aspect, and they would only want to deal with it from that aspect, or they then do it from a conventional aspect. And there's a lot of practitioners or psychologists that are trying to integrate, and then there's that pushback. But as Dr. Mandu was explaining, I think it's because of this framework that's so rigid that even when as a mental health practitioner, you want to push back and you want to explore, it becomes quite difficult. So Odwa, my question to you really was, it was going to be about how how could mental health practitioners maybe, like, how do they push this integration so that clients are more receptive? But then also maybe from your master's, you mentioned something about perceptions in your research. Was it perceptions from clients, and how maybe was there something that they were more receptive? Thanks.
Thank you. Yes, my master's research and also research after my master's, it actually looked at the perceptions, especially from those communities or those clients who prefer to use the indigenous ways of seeking treatment. So for me, as I've said, as I've mentioned that this is not to replace, but to provide an alternative. Some may prefer the Western approach, and if it works for them, that's fine. And for some, the indigenous or the African-centered approach, it works. So it's more of what the community or what the client needs and what works for each person. So there's no one that is more superior than the other one, but it's more of an option. And yes, many psychologists and many African psychologists are trying to look into that integrated approach. And yes, that the framework that's currently in place is the one that is posing limitations. And I actually agree with what Dr. Mandu said, that now it is upon academics to push for this integrated approach.
Thank you very much, Ottawa. And I see that before Dr. Ojelade, before they leave, they're saying that I think your point is important. In the U.S., professional associations write guides on working with particular populations. That can occur in this case also. I would love to participate in that. One deal in a moment. There's a question here from Mark Tuggle. Is he still there? Is Mark still with us?
Yes, I'm still here.
Yes, Mark, would you like to raise your question for Ottawa?
Yes, thank you. And thank you, Antoine, for facilitating and hosting this really powerful webinar. Thank you, Audra, for opening my heart and raising my consciousness. I'm curious about the role of music. I think music can be used as a toy for joy. My question is in the chat. What role, if any, does music play in treating mental illnesses with people who don't believe in conventional Western approaches? Thank you.
Thank you, Mark. Your volume was a little low, but I think, Ottawa, did you get Mark's question?
Yes, I did. I'm not sure on what type of music you are referring to, but research has shown that is music, especially in music that is often used in traditional practices, often does have some effect or influence in healing or dealing with mental illness. Remember, I mentioned that now in different communities whereby now they adopt certain rituals, and music often becomes part of those rituals. And it does have a profound impact when it comes to dealing or treating a mental illness. I hope you're referring to that type of music.
Thank you, Ottawa. Wandile, Professor Sabedzi, you have a question?
Thank you, Antonio. For me, it's not a question also. It's just to, I think Dr. Litsualo touched on it or asked about it when it comes to the research aspect. And one of the speaker also, one of the attendees asked about it to say, when it comes to the writing part, we always find ourselves that we need to start with the Western approach, and then coming to our context. I will give an example of the South African context, of which I have noticed with myself to say, I think it's the way we were trained to say, come from the global perspective and then narrow it down to the South African context. We'll always say South African context or into your context. And now I have learned when I attend such webinars to say, actually, I need to decolonize, or I need to know that my voice matters. What I say. So just to say to Dr. Lutalo and the other speaker to say, it's always difficult even for us in the research space to say, let me start from the center, which research topic am I looking at? I will always say, let me start from the global aspect perspective. But then now, as time goes on, you get to gain confidence as a writer to say, even if Antonia or someone who believes in the Western approach or Western healing, African context or African context, it's okay and it's allowed. So I think it falls under the learning curve of saying we are trying even to decolonize the way we write as researchers in the space of psychology or in the space of healing. Thank you.
Thanks, Wandile. Odwa, do you have any comment to that? Because I think Wandile is raising a couple of different things in his question. One is particularly about the writing and the aspect, the issue of decolonizing, and what does that really look like? Because I actually just put a comment on Facebook a few days ago about the whole construct. Everybody is jumping on the decolonization bandwagon, but what does decolonization look like? Are we writing from the perspective, from the Western European and American perspective first, and then trying to pull in the traditional or the cultural perspective afterwards? How do we need to really look at this? So quickly, if you can, Adwa.
It also has its challenges, because first of all, our writings are not widely accepted. They are often, especially now if you're submitting your research or for publication or anything, it is often reviewed by someone who is more inclined, for example, to a Western approach of things, of which they may not see it, or they might be biased now when it comes to reviewing your paper. So it often comes with challenges. I've had troubles, for example, with getting my writings to be accepted for publications, or that's because of the audience that is receiving our writings. Or if you write it in a way that you can understand it from an African perspective, but now it has to be reviewed by someone who's gonna look it into their often in their own perspective, of which now this often clash. And it's yeah, it does come as a challenge.
Thank you. I have two more questions, and I think after this, we should probably end, even though we are scheduled to go until 12:30. But I want to be able to give Ottawa a chance to rest. He's been pushing this. So there are now two questions, Brian, and then Machepo Let's you can ask your question. So Brian, and then Machepo Let's Brian?
Yes. Can you hear me clearly?
Yes.
Okay. So my question is, how has social media impacted the way people use traditional healing practices versus Western medicinal practices? And that's including basic therapy to actual medication. And I can clarify if I need to a little more.
Please do.
Okay, so I'm a part of the millennial crowd, and I'm noticing that there is an uptick on mental health talking, whether it's on Facebook or Instagram, and then of course, there's now TikTok. And so it's a lot of talk about seeing therapists, getting on medication, having conversations, but I have not seen too much talk on traditional practices. So I was wondering if you thought that that was a impact on, if that has taken an impact on traditional medicines versus Western medicines.
All right. Thank you for your question. Obviously, as you've just said, you part of, you say, millennials, yes, of which, in that case, you'd be more exposed to the Western approach to treatment compared to traditional healing. Meaning that now, for example, for such an age group, they're more exposed to the Western approach, because now when it comes to traditional medicine, it's very rare for to find such things on social media. So I think in that way, when that is through now exposure, it would favor, social media would favor more the Western approach to treatment.
Thank you very much, Awa. Mashepo Letswalo, I apologize if I mispronounce your name. Would you go ahead and ask your question?
Thank you so much, and good evening to everyone. So my question was actually around if there are any policies. I don't know if maybe he already mentioned it, and I'm sorry I joined a little bit late. I wanted to check if there are perhaps any policies that he found around culture and religion and application and practice of mental health when it comes to that, because in my understanding as of now, the only thing that is maybe waiting or holding back the collaboration or integration of traditional medicine to Western or religious intervention to mental health care, it's probably because of policies in place and regulating the system right now, as Dr. Letswalo indicated, a back and forth of that. So what are the policies that you found that thus far when it comes to practicing of mental health care in a religious or cultural from a religious or cultural perspective? And in summary, what would you say they're trying to say so far? Yeah, I hope my question is clear. Thanks.
Thank you for your question. Yes, there are policies in place. In South Africa, I know that the government has been taking steps in trying to recognize as well as to formalize, African traditional medicine, because I know that there is a Traditional Health Practitioners Act of 2007 or something. Yes, of which now this was established to recognize this. But even though these are in place, despite these efforts, but there are still challenges that are there when it comes to integrating these systems, because now these traditional practices, they still continue to be marginalized. HPCSA still doesn't recognize them, so they still cannot be used in practice, and as they're still perceived as less scientific when in comparison to these biomedical methods. So yes, there are acts in place. There is the Directorate for Traditional Medicine in the Department of Health, but now the issue comes now with integrating these into practice. Hence, now the back and forth.
Thank you very much, Adwa. Are there any other comments or thoughts or questions or concerns? No? Okay, so what we'd like to do to bring this to a close is to share with you our next webinar, which is going to be on September 13th. And will be presented by Thembika Sedani. I apologize for mispronouncing their name. But if you have your phones available, you can scan the QR code at the bottom of the screen, and you can register in advance for the September 13th webinar, where we'll be talking about rituals and well-being, culture as it intersects with psychology. And again, we are continuing this discussion and building towards the Ancestral Institute that will be held on November 8th to the 10th in Puerto Rico, in collaboration with the General Studies Department at the University of Puerto Rico and Rio Piedras campus in Puerto Rico. So we invite you to scan the QR code and register for our September 13th, 2024 Rituals and Wellbeing Culture as it intersects with psychology. Okay, this is the same QR code here. And thank you guys. Thank you all very much. And we look forward to seeing you on September 13th. And thank you very much again, Ottawa, for sharing this opportunity with us and providing us some much needed information on how we can bring both religion and culture and meld it with psychology, with contemporary mental illness, or what it looks like as mental illness or mental health for Black and Indigenous communities. All right, and thank you very much. And with that, we see you on the 13th of September.
Thank you. Bye.
Thank you all.
Thank you all. Bye.